I'm Leslie with Angels Care Home Health. So home health is easily confused with home care. So hopefully I'll explain the difference between the two. So we are 100% covered under a Medicare benefit. I always tell anyone I'm in front of, use your Medicare benefit. If you have it, use it. A lot of times home health is, when people hear homebound, they think of bedbound. Homebound is not bedbound. On home health, you just need a taxing effort to leave your home. Whether that taxing effort is you need to go with your daughter to the grocery store, or you can still go to the grocery store, you just now need to use a cane or a walker. Or you used to be able to go through 2 aisles, and now you're having to take a break because you're breathing so heavily. All of those things would be considered homebound. We do provide skilled nursing, physical therapy, occupational therapy, speech therapy, a home health aide, which is a bath aide twice a week, and then also social work. Those are all disciplines covered under home health, not necessarily meaning you have an order for home health, you're going to need every discipline. It's patient specific, so whatever you're needing at that time. Generally, the first time you know about home health, unfortunately, is after hospital, right? You're in the hospital, broken hip, maybe you had COVID and had a longer hospital stay. You're going to be given a list of probably 5 to 7 names, and you're going to have no clue what any of those are, and you're going to have to pick one. And whoever you pick is going to be the ones that generally come into your home and provide those services. What home health really should be is proactive, right? We want to get there when we're in the doctor's office with a loved one and they've had 5 falls in the last 3 months, right? Generally, what's going to happen is doctor's probably going to send them home. They're going to have an ER visit, and then ultimately they're probably going to end up in the hospital. Home health can help prevent that hospitalization. So if we can get in there after the first fall and work with PT on mobility and getting the core stronger, so we can get from a seated position to a standing position without getting wobbly and end up in a fall. That's something that home health can do more proactively with a primary care physician. Another thing that we can do is, something as simple as a medication change. A lot of us, as we get aging, we get more prescriptions, whether it's cholesterol, whether it's blood pressure. All of those things, generally we're in front of a doctor for 15 minutes. A lot of the times we get home and we're like, oh my gosh, am I taking this twice a day? Am I taking this 3 times a day? Do I have to take it in the morning? Do I have to take it at night? All of those things. That's something that home health, we're educators. So a skilled need for home health with our nurse is actually education. So we come in, we make sure you understand the medications you're taking, when you need to take it. We can fill the medication up. And then we're also in there weekly asking if there's any side effects, right? Maybe you're taking something over the counter that you don't even realize is going to affect the prescription you're now taking. All of those things are covered under a home health benefit. Again, 100% covered by Medicare, so nothing out of pocket. And that's really where we can benefit the most in helping with hospitalizations, or something that Medicare's really been concerned about over the last probably 10 to 15 years is rehospitalizations. Because a lot of times somebody goes into the hospital and then the window is anywhere between 48 hours to 2 weeks after that hospitalization. They're ending up either in the ER or another hospitalization because they get home and they're just not quite ready, and they don't have the layers of care that they need in order to prevent that hospitalization, which is costing all of us a lot of money. So that's, again, something that home health can really come in and help and make sure that we're not sending people right back to the hospital after initial hospitalization. So I'm Leslie with Angels Care Home Health. Thank you.